Good afternoon and good evening, depending on where you are joining us from. Many thanks for joining us for the session in the Patient Safety Conference. My name is Dr. Rahul. I'm a Senior Vice President, Clinical Adoption and Engagement at Malaffi, which is a health information exchange platform in the Emirate of Abu Dhabi in the UAE. I'm also a practicing consultant of family medicine. I would like to take you through the importance of connected health and how it is so closely related to patient safety. Patient expectations, clinicians' expectations, and how it helps reduce burden of information on the clinicians and alleviate a lot of the stresses that happens with information overload, presenting information in a succinct manner to the clinicians, and generally on the what, how, and why connected health is important for patient safety as a theme. Before I start, I would also like to say patient safety doesn't mean the absence of harm. Patient safety is actually a culture that we abide by. It is part of our workflow that we adopt to make sure that whatever we practice and however we practice, we do no harm to our patients firstly. So thank you again for your time, and I will take you through some slides now. Most of the slides will give us testimonials from care providers on how connected health has helped them, specifically the Malaffi Health Information Exchange platform, and just a quick brief overview of what we do here at Malaffi and how we entwine ourselves in the clinician's clinical life and help them and their patients. So Health Information Exchange by name achieves aggregating all the data. So all clinical data in the Emirate of Abu Dhabi is unified into a patient file, which is called Malaffi. It enables coordinated care, deliver it safely and securely. What it also does is it gives and presents to the clinicians pertinent information within their workflows whilst they're interacting with their patients. It reduces unnecessary utilization or duplication. It reduces the turnaround time because information is available now. The patient doesn't have to go and fetch their old records from other facilities. They don't have to spend extra time, repeat appointments, and loss of efficiencies that happen. It also improves the tracking of important markers for public health perspective and for the perspective of commissioners like the regulator, the Department of Health, by presenting relevant information back to them. Just a quick snapshot of where we are with Malaffi in the Emirate of Abu Dhabi. So we are proud to say that we have connected 100% of all Abu Dhabi hospitals, which is the inpatient beds, 92% of all the clinics and the smaller centers, and 98% of all clinical episodes are now connected to Malaffi in the Emirate of Abu Dhabi. As you will see, we also connect 61 electronic medical records, which is quite a few, and get all the significant information. Speaking of which, these are our partners who participate with Malaffi sharing the data. So they're all the clinical health providers in the Emirate of Abu Dhabi. The major and the key and the bigger providers are listed here. We also present information on our website, which is mentioned below, where we display the connection status and exactly what all data points they connect with Malaffi, which is a very important part of our activity. Speaking of clinical data now, the important and the key word here is real-time clinical data. What does that mean? Which means when we connect patient demographics, encounters, problems and diagnoses, allergies, which is a very important safety aspect, medications list to avoid interactions, etc., and lab and radiology results and procedures, including clinical documents. All this is done once the clinicians close their consultation and finalize it. It's available for another clinician involved in the coordination of care to look at that piece of information and act accordingly. We also continuously enhance our data points in Malaffi. We work very closely with the Clinical Advisory Committee, which is a set of practicing clinicians in the region who advise us on what extra data points can be added to Malaffi to make their lives much easier, to improve patient safety, and to give more meaningful information to them. And on that lines, the data points that we are currently onboarding from our participants are clinical documents, immunizations, which doesn't stop just at COVID vaccines, but also childhood vaccines, ad hoc vaccines, travel vaccinations, and all sorts. Vital signs is a very important part, especially when we deal with patients who have issues with respiratory problems, heart failure, because we can monitor their oxygen saturations as a trend. We can also monitor their blood pressure and their weight. Rather than having siloed information at different providers, different physicians and facilities, Malaffi can present it in one single dashboard. Another very important and interesting aspect of data that we're working on currently is how we can combine and take all the images done in the Emirate of Abu Dhabi and present it to the clinicians. Why we're doing that is because we found that a number of our surgical colleagues prefer to see the images themselves because it helps them align and it helps them orient themselves on where their surgical site of action will be. At times, this leads to, currently in the market, it leads to delay because we either wait for our patients to bring us CDs or other formats or file share of these images, and that means unnecessary trips back to the hospital and to and fro. And at times, unfortunately, it also requires a duplicate images, a duplication of a study, because we are unable to get those images anywhere. And that exposes patients to other sort of risk like exposure to radiation, further delay and delay in treatment that could be really important in certain cases. So this is where Malaffi comes and adds value to the clinical and clinician provider community in the Emirate of Abu Dhabi. We're also proud to say we are the first health information exchange in the region and one of the fastest growing health information exchanges, as our stats just testified for. Now, some little snapshots of how we integrate Malaffi. So if you look at this screen, this is from one of the participants' EMRs. Malaffi is embedded as a little icon, which I can just highlight here. The clinician just needs to click on it. They don't have to log on to a separate portal. They don't have to remember passwords or anything like that. Automatically, Malaffi would present information pertinent to the patient on your screen by clicking it. One click and you get all relevant information like this. Why I say relevant? Because allergies is one of the first things that comes to my mind and goes to before I start prescribing. I also want to see patient's encounter history. Where has the patient been? Sometimes patients can have a vague history of where they've been, whom they saw, and which specialty they saw. But that helps us guide where the patient's care diary has been, problems, and obviously the procedures. And on the left, if you see, we can also look at patients' lab results from all the facilities in Abu Dhabi, microbiology results, and also radiology results. So this gives us a very quick snapshot. In my practice, when I look at this, and this is something which has been testimonialed by a lot of our colleagues, it takes me about 4 or 5 minutes to get myself up to speed with the patient's care, even if it's a brand new patient and I'm seeing the patient for the first time. It's a very good ready reckoner for us. I'll start with the testimonials now. And the most important testimonial comes from one of our patients, who is a complex care patient who approached us to say how happy she was. So what the patient says is that Malaffi is a brilliant initiative. She has benefited a lot from it. All her doctors and care providers can see her full history and test results. She doesn't have to narrate her whole story again and again and carry bulky files and medical records around, especially true for a complex care patient. The doctors can also see the medications that she takes, and importantly, not prescribe any medication or co-prescribe things that interact with each other. An interesting thing comes out, a theme comes out here, that how patients themselves have an expectation that physicians will act on best behest for them and for making sure that their medications don't interact with them or cause any harm. She loves the system for that. She also wants to implore to all healthcare providers to look at the system because it helps reduce the burden, it helps reduce patient journey, and it adds patient safety element to it. We are very fortunate that we have a very involved group of community and providers and patients. She went ahead and agreed to be videoed, and this is her testimony, which I would like to share with you.
My name is Sophia. I live in Abu Dhabi and I'm a cancer survivor. My cancer was diagnosed in 2016 and I underwent treatment for cancer for 3 years and more. And in 2019, I was declared cancer-free. While I was going through my cancer treatment, the 3 years or so, there was no centralized medical record system as such that all the doctors, all the different hospitals that I visited could access to. So I had to carry all my files and all my CDs and everything. And sometimes I would forget. Sometimes they would not be available at that time. So it would be frustrating that I had to go back, get another appointment, take my records back to the doctor, show it to them, and then they would decide if they want to do a certain test or not, or give me certain medication or not. But now with Malaffi, it's very convenient for me. I just get up and go for my appointment, and I tell them this is, check in on Malaffi. I tell the doctors, and they look at it on Malaffi, and they find all my records there, all my tests, all the medication that I'm taking. So everything is there, and I don't have to tell them anything. I don't have to bother with carrying stuff. You can imagine my relief when Dr. Muhammad Al-Khatib at Health Plus told me about Malaffi. And now healthcare providers in Abu Dhabi can access my medical history through Malaffi safely and securely.
When Sophia came to me, and I know her case from the endocrinology side, so about her diabetes, about her thyroid issue, and when she came to me and mentioned that she's a cancer patient, so I wanted to look up because she didn't have all her reports with her, she didn't have anything to show me. When I asked her about what kind of cancer and how was it treated and what kind of imaging was done, she was surprised that she said she doesn't have it, and we tried to figure out what was done. And then she mentioned that she had several visits and CTs and MRIs done in Cleveland. So I thought, okay, then let's open Malaffi. And then she was surprised and asked me, what is Malaffi? And I explained to her that Malaffi is now a platform where all files of the patients in several clinics are connected to it. Every doctor has access to it, you can see it. So we know exactly then when was the MRI done, what was the CT, what were the findings. And then she was happy because she said, I don't have this printout, she doesn't have any hard copies. So that helped me a lot to see what was her previous diagnosis and all the diagnostics that were done. And so I can start my own investigations regarding her diseases, her current diseases.
As a patient, I simply love this system. And I'm very happy that in the near future, patients like me will have access to their centralized medical records. I really urge all the healthcare providers in Abu Dhabi to use Malaffi so they can provide better and safer care for their patients.
I'm going to give you one example. I have seen one young patient. She came with abdominal pain, vague abdominal pain. When we asked about history, previous medical problems, do you have any previous medical problems? She said she's not sure, but as far as she knows, she was okay. So she was hesitant. That pushed me to look at Malaffi. When I looked, I found this patient, she's having chronic kidney disease and she needs pain medication, but safely we didn't give anything to harm her, So I could reach her result. I could explain to her, like, you have a chronic medical problem and this is like need special consideration in giving treatment, painkillers. We were able to compare her previous result with new result. We could know that she's in a stable disease of stable disease now of chronic kidney disease, stable stage of chronic kidney disease now. So, and we could able to manage her safely because of help of Malaffi, and then we refer her safely to nephrologist.
Malaffi has been a wonderful addition to the services offered and the technology here at Kennett Hospital. We've been very glad to partner with Malaffi. We've seen it really impact patients in two main ways. The first is just the coordination of care. So as patients come and they're coming with a certain illness or disease, maybe they need specialist care at a different hospital or they've seen multiple facilities, we can pull together their care and coordinate it, and that provides them the highest level of care with the most accuracy. The second is the reduction in the use of needless services. And so when patients come and have had testing in an outside facility, we can see that. We don't have to repeat all those tests because of the patient's lack of knowledge or the unavailability of the records. And so to be able to efficiently and effectively coordinate their care while not having to perform unnecessary services has been a real benefit that Malaffi's brought to the hospital.
Just wanted to give you a brief overview of hospital-acquired acute kidney injury. Now, as you see here, these are some figures on hospital-acquired acute kidney injury and how that affects patients' morbidity as inpatient care. How we can reduce that is by recognition of early chronic kidney disease, avoiding medications like non-steroidal inflammatories that we just saw as an example, and other medications that affect kidney functions. By reducing that, we can reduce harm, we can reduce the hospital stay for the patients and other incidental consequences of that. I would like to now go to another testimonial that we have, this time from a physiotherapy colleague. Says, I had a patient who referred to me for physio with a vague diagnosis of knee pain. I checked his Malaffi file, and from the problem list and the MRI report, I came to know that he has a Baker's cyst. Having this information completely changed the plan of care for the patient. This is an excellent example of how Malaffi helps clinicians during their workflow make faster decisions, more efficient decisions. And if they need to escalate care, they're able to do it then and there. They don't have to wait for other tests to happen. Some notes on this particular testimonial. So there was specifically in some conditions like emergency department visits or physiotherapy visits, if you have the pertinent information, you can make faster decisions. It improves the overall patient satisfaction and the confidence in the healthcare system. Harm reduction by duplicating of tests and the obvious cost reduction from preventing duplication of unnecessary tests. On that, we have another testimonial from a physician that we previously interviewed. This is a very important example of how Malaffi helped reduce duplication or exposure to radiation. So the doctor says that a patient came to the hospital with abdominal pain after visiting another facility, a government facility, where they had done a recent CT scan and some blood work. The patient was delighted to hear that we had access to that information, which is the CT scan report and the blood work report, and they didn't need to repeat the procedure or go and get the medical reports again, alluding to reduction in the time lag between making decisions, and most importantly, exposure to radiation. Just some facts here. Reduction in risk of exposure to radiation. So an abdominal CT scan exposes approximately 10 times the radiation of a standard X-ray, which is in no one's benefit if there is already an existing report and the test is unnecessary. Prevents a delay in care in fluid situations like CT in ED visits, where at times with evolving symptoms, we rush into doing tests. If we have the benefit of a recent study that was done and we can reduce that, it means faster turnaround time for decision making. It helps reduce clinical errors, medication errors. Risk from contrast material in this case would have been by duplication of tests. It overall improves patient satisfaction again, and the faith of the clinicians and the patients in the healthcare ecosystem, and the cost reduction from preventing duplication of tests. I land on one of the last testimonials that we have, and this is from a consultant medicine who says that because we have instant access to the summary of medical information in Malaffi, our new patients, that are patients that we don't previously know, are particularly satisfied and happy. They feel that we already know them, even if we see them for the first time. And this allows us to spend more face time with them, since we can review their information prior to the appointment. This brings to a very important point on how the patient's satisfaction is improved. I would like to dwell on it for a couple of minutes, because this is very close to my heart as well in my practice. Our patients increasingly expect us to give them more face time rather than us sharing screen time with the computer. A new patient, especially complex care patient, can mean and take a lot of time away from us, our interaction with the patient, by having to interact with the screen, because we're trying to piece together all the relevant information. If you imagine the amount of information that the doctor has to ingest during that visit of a brand new patient can sometimes distract them with unnecessary information or take more time to piece the information together. By presenting the information on Malaffi in a succinct manner, we have achieved, and we are trying to achieve even further, reducing in the information overload to the doctor. There are a number of articles and statistics that show that overload of information, no access to data, can actually cause physician and clinician burnout. And that itself leads to patient safety issues. I bring to your notice an article on the Journal of American Medicine, which said there is a clear-cut association between physician burnout and patient safety. And the conclusion was the evidence that physician burnout can jeopardize patient care. Reversal of this risk has to be viewed as a fundamental healthcare policy goal across the globe. This is something that we are very proud of, that we partner with our clinicians, we add value to them, we add value to our patients, and we contribute as a tool towards a happy and safe patient ecosystem in the Emirate of Abu Dhabi. We were fortunate enough to have presented our success story at HIMSS in Las Vegas this year. We did a number of talks about how we helped patients, how we helped clinicians, and how we helped commissioners and public health departments with our data. I'm more than happy for you to contact me, to know more about Malaffi, to do more what we do, and how we enhance care and patient safety in the region. Thank you for listening. I hope you all well, and I wish you all well and stay safe. Thank you and all the best.